From the JAMA Network, this is JAMA Dermatology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Dermatology.
Hello and welcome to this author interview from the JAMA Network. This is Dr. Adamson, the web editor for JAMA Dermatology. Hidradenitis Suppurativa, or HS, is a chronic inflammatory disorder of the skin that primarily affects the axilla, the inguinal, inframammary, and buttock areas. This disorder disproportionately affects women of reproductive age, but the impact on maternal and offspring health is unclear. More specifically, little is known about adverse outcomes in pregnant patients with HS and their offspring. In a new study in JAMA Dermatology, authors aimed to determine the association of HS with pregnancy outcomes and future maternal and child morbidity. Dr. Nathalie Auger is a clinical professor in the Department of Social and Preventive Medicine in the School of Public Health at the University of Montréal. She is the corresponding author of this new study, and she is joined by Dr. Vincent Piguet, who is a professor and chair of dermatology at Women's College Hospital and at the University of Toronto in Canada. They are both here to discuss this work and its potential implications. Welcome to the podcast, Drs. Auger and Piguet.
Thank you so much, Ade. It's a pleasure to be here today.
All right. So how did you all connect? One's in Montreal and one's in Toronto. How did you guys meet on this project? What was the kind of impetus of it?
I'd say it was through distant connections. We were both in touch with a medical student who has an interest in dermatology. The student contacted me and also, I believe, Vincent. That's how we connected.
And so, Nathalie, before this, did you have an interest in dermatology? Because I know you do a lot of work in clinical epidemiology, but was this your first foray into dermatology?
This is probably the first time I worked on a dermatologic outcome. There's different topics I certainly touch upon, mostly related to maternal and child health in some way. Rarely it's touched upon skin issues. So it was interesting to be involved in that project for that reason.
And Vincent, what drew you to this project? Are you big into HS? Is that a large part of your practice?
Yes, I've been interested in HS for quite some time. Actually, my interest for HS was started by a very talented resident at the time called John Ingram. Back then, I was chair of dermatology in Cardiff in Wales in the UK. And John approached me, was a chair already, he was a resident, and he said, look, Vincent, I think you need to study HS because it's a really important disease. It affects a lot of people, and it's understudied. And at the time, it was over 10, 15 years ago, a lot less was known about this disease. There was a lot less interest than we have today. And we performed an important study in Britain looking at all the primary care data available, trying to understand how frequent is this condition. And we realized in the British population, it was affecting probably over 1% of the population. And of course, as you mentioned earlier, as we all know, it disproportionately affects female patients. So probably more than 1% of female patients in that context. And naturally, when I moved to Canada, I was recruited at the University of Toronto, and in my hospital, we continued these studies, and I was quite involved in HS. So I'm one of the organizers of the SHSA meeting, which is the North American HS meeting. And actually, I met Kai Lee, who is this phenomenal medical student who approached me and said, we're doing a study for maternal health and HS, and would you be interested to join the team? And I think that's how Nathalie and I met each other, mostly virtually, I have to say. We've yet to meet in person. It was a phenomenal work that was developed, and I'm not surprised it ends up in a fantastic journal.
So, Nathalie, you were involved in a lot of database studies. Would you mind telling the audience a bit about the data set that you had at your disposal in order to answer this question? What are the outcomes in HS in people that are pregnant and their infants?
Sure. Yeah, I can tell you about some of the data that we have available. Maybe a bit of background. So Quebec, Canada is where we did this study. And fortunately, in Quebec, there's a publicly funded healthcare system that means that everyone is covered under public healthcare especially their hospital-based care. So every patient who's treated in a hospital is entered into a specific database. This includes all people who deliver, all pregnant people who have a pregnancy and deliver in hospital, and as well as their newborn, and any other admissions they may have had before or after that event. So what we were able to do is identify those pregnant individuals, identify their newborns, and also create a separate data set that involves all those individuals along with their follow-up over time. What's fortunate is that the data also includes prenatal care information. So any care that you had during the obstetric follow-up in ambulatory care.
So I understand that the data set was largely around people that were pregnant, and then you kind of had two groups. You had people that were pregnant and delivered and had HS, and then you had a group of people that did not have HS
Yes,
and also delivered.
that's exactly correct.
And how did you identify those people that had HS? What were the rules of entry for people to be identified as having HS?
Yes, so two ways. One way is that if you had a history of HS and required care for it during pregnancy, during follow-up, or in your prenatal chart somewhere, we would capture that diagnosis of HS. The other way was if you were ever admitted for a complication of HS before or after a pregnancy and required hospitalization for that.
And was there any way to know how severe or mild the HS was in this data set, or is that not possible?
Unfortunately, that was not possible. However, the majority were probably more severe cases that we identified just because of the nature of the data set, that we used hospital data mostly.
Okay. And what was your hypothesis, Vincent, going into this study? So you have this cohort, got patients with HS, patients without HS. What kind of disorders or outcomes were you looking for from the maternal side and then for the infant side?
We know in HS there are a lot of comorbidities, right? One of them being, for instance, metabolic syndrome. So we have often these type of challenges in HS, some also joint disease, mental health issues. There are so many problems. And I think this study was exciting because it was not just looking at the maternal side of things, but also the infant side. And to be fair, we know a lot less about what's the outcome for the infants of people who have HS. And so these are the two sides that Nathalie's group and the whole team we were able to tackle is not just looking at the mother's health, but also the infants.
And so, Nathalie, what were the main results that were found in this study? Can you first start with what you found for the maternal health side of things?
Yes. So in all, there are about 1.3 million women. Around 1,300 or so had HS. There were a lot of outcomes. So I won't go into detail, but basically at delivery, there was a greater risk of adverse events, especially outcomes such as preeclampsia, other hypertensive disorders of pregnancy, gestational diabetes, severe maternal morbidity. That was very interesting. Results in terms of severe maternal morbidity. So severe maternal morbidity includes outcomes that are more of a life-threatening, I'd say. And we found particularly high risk of that as well. Cesarean delivery, those types of outcomes were more frequent among women at delivery.
Yeah, what about among the infant side?
Yes. So, of course, among the infants, they're not going to be excluded from that. Preterm birth, birth defects especially. That was particularly interesting. The risk of birth defects, heart defects, and oral clefts especially.
Hmm.
Yeah. So the infants were not excluded from adverse outcomes as well.
And Vincent, was this something that was surprising to you? Because there are quite a bit of positively associated outcomes that are quite disturbing, birth defects and preeclampsia, hypertensive disorder. Did this surprise you?
I was quite shocked, to be honest, because I don't think a lot of our colleagues in gynecology or even other dermatologists in our own specialty, we were well prepared for this type of result. And I think that's prompted me to think a little bit more whether we would need to maybe organize special pathways for people having children who have a severe HS. and whether we need to look more carefully at this whole area of maternal and fetal health in HS. I think there's still a lot of unknown, and the strengths of the studies, of course, based on a large number of patients that are involved. But of course, like always, we're looking at codes. There's always limitation to databases. So I think more work needs to be done to reproduce the data, to validate it in different settings. But I think it certainly was a surprise.
And what about you, Nathalie? I know this is one of your first forays into skin. Did some of these results surprise you with your deep knowledge of maternal health?
Yes, I'd say that's an excellent question. Just because our team does look at a bunch of different exposures and outcomes. So I'd say that this is one particular disorder, HS, that was associated with some of the more adverse outcomes, especially in the long term, like the long-term outcomes of the mothers and of the children as well. They were a bit stronger than some of the other disorders we examined in the past. Trying to think of it as a disease that comes to mind, PCOS, polycystic ovary syndrome. I remember looking at that. I'd say that some of the similar kinds of things that we found for that disorder were present with HS.
And so, Vincent, what's next? Do you think there's something that we need to investigate further and figure out, how exactly what the pathway is into why is it that people with HS that are pregnant have all of these adverse outcomes, at least potentially? Do we need to have those folks on better treatment? Will treatment kind of help this? What do you think clinically with this information that we have from your study we need to do moving forward? Or what's the next study?
I think for me, clearly the risk for fetal health was not well known before this study. And I think that really prompts us to look at that more carefully, to work maybe more closely with gynecology or OBGYN teams to really address both sides, right? Mother's health, birth, as well as the children. And I think the long-term issues that Nathalie mentioned are particularly concerning. So I think also, at least in Toronto, we have work now closely with the Sick Kids Hospital, which is our big sort of children hospital, to establish a cohort also for children with HS. And so perhaps working closer with Sick Kids as well to look at children of parents who have HS essentially and trying to study that more closely. So I think that's one side of things. Other thing is obviously we hope other cohorts in other databases will be used to look at those questions and hopefully confirm and validate in different countries, different settings, similar results. And of course, one thing that we know from database research is often HS is underreported. There's a long delay for diagnosis. In our cohort, for instance, in Ontario, most patients have a delay to diagnosis that's in the range of at least 10 years. So a lot of these people are not diagnosed, and maybe there's even a higher rate, or maybe there's a lower rate in people who have mild HS. There's a lot of uncertainty around these questions, to be honest. And I think there's a lot more to understand. The other side of the coin, of course, is the mechanisms of these issues, like what causes that, what's the pathogenesis? Is it autoantibodies in the same way as lupus? Is it just inflammation that causes the issues for maternal and fetal health? So a lot of uncertainty as well in terms of mechanisms.
So your results are, as I think Vincent said, they're surprising and concerning. But I also think that they should be put into perspective, right? The relative risk increases or 30 to 60% and more for certain of these outcomes. But I want to know at an absolute level, were the absolute risk increases really, really big? And also, can this study be generalized to everyone with HS, or are we talking about a select group?
Maybe I could tackle the first part of that question. Yes, I think it's a good point because the results were surprising, but important to keep in context that no matter what, a lot of the outcomes that we examined were quite rare. Ultimately, most women with HS, even though they have a slightly higher risk, will never develop these outcomes. The majority will be fine. That's the positive point of all this, is that most people should not be worried. But nevertheless, there is an opportunity to reduce some outcomes and improve the health of these patients despite the associations that we found.
I agree with Nathalie 100%. I think in practice, it's the relative risk is always more impressive than the absolute risk, and we have that for many situations. But nevertheless, I think for me as a clinician involved with seeing many patients with HS, I think it raises my awareness that we need to pay special attention to maternal and fetal health, that there's an increased risk, that's clear. I don't think there's any doubt. But as you said, there are a lot of uncertainties around database. We know that most databases tend to capture the more severe end of the spectrum of HS. So perhaps a lot of mild or stage 1 sort of HS may not have the same adverse outcomes. And this needs to be looked at, perhaps using other methods or other databases which would capture, for instance, severity of disease. I think it's a good point you brought earlier. And I don't think that using the Quebec database, we really have a good understanding of what's the severity of the patients that were involved, but we expect it would be the more severe patients, right? So perhaps for a vast majority of HS patients, this does not really apply, but maybe to a fraction that is severe. I think that's one of the uncertainties. But nevertheless, I think it's an important area to keep studying and being vigilant about. And whether it should be included in next guidelines, for instance, of the AAD produces a lot of guidelines. I've been working with some of the guidelines regarding management of comorbidities in HS. That's certainly an area, maternal fetal health, that we will have to look at for the next guidelines.
Nathalie and Vincent, I really want to thank you all for being on the podcast today. I am Dr. Adewole Adamson, and I've been speaking with Dr. Nathalie Auger and Dr. Vincent Piguet about pregnancy-related outcomes among patients with HS. You can find a link to the paper in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Musisi at the JAMA Network. Thanks for listening. Catch you on the next episode of the JAMA Dermatology Podcast.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.